Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How fast or how long does it take Biktarvy to work? How long does Biktarvy take to work? Biktarvy, bictegravir, tenofovir, and emtricitabine usually starts working within the first 4 weeks, with a noticeable reduction in HIV viral load, amount of HIV virus in your blood. Within 3 to 6 months, the viral load in a large proportion of people falls to an undetectable level. When you start Biktarvy, the number of your CD4 plus T cells usually increases gradually. It is important to have your HIV viral load checked regularly to make sure you have reached and stay in the undetectable range. If your viral load is still detectable, it is important to discuss this with your healthcare provider. Figures from clinical trials. In clinical trials to measure how well Biktarvy worked to treat HIV, they looked at how much the viral load decreased and whether the CD4 levels increased. In a clinical trial, NCT02607930, for Bikarvy, they looked at what the viral load was in patients after 48 weeks of treatment. After this treatment time, 92.4% of patients had a viral load of 50 copies per milliliter and 87.6% had a viral load of 20 copies per milliliter. They also measured the increase in the number of CD4 plus T cells from median baseline levels, and the mean increase was 233 cellsLWhat. What is viral load in HIV? The viral load is the amount of HIV genetic material in your blood. You usually get your viral load measured when you first find out you have HIV and just before you start Biktarvy. You will also get tests done after a month, 3 months and 6 months to ensure that the medicine is working for you and that the viral load is reducing. What is an undetectable viral load? One of the goals of Biklarvy is to have an undetectable viral load. This is when the amount of HIV genetic material is at a level that is too small to be detected, usually less than 50 copies of HIV per milliliter of blood, less than 50 copies per milliliter. Undetectable doesn't mean HIV has completely gone from your body, it is just a level that is unmeasurable. Related questions: which medicines should not be taken with Biktarvy? Can Biktarvy be used for PrEP or PEP? What if I miss a dose of Biktarvy? What are CD4 plus T cells? CD4 plus T cells are important cells in our immune system. HIV infection causes the number of CD4 plus T cells to be reduced. Once the levels become too low, the immune system doesn't work well and you are more likely to get infections and cancers, leading to the development of acquired immunodeficiency syndrome, AIDS. What is the goal of Biktarvy treatment? The goal of Biktarvy treatment for HIV is to keep us well, by decreasing the HIV viral load to undetectable. Once HIV viral load is low, the CD4 plus T cells levels increase, meaning the immune system will function more normally. When the level of HIV in your body is reduced to undetectable, it also reduces the risk of you passing on HIV. By getting and staying at an undetectable HIV viral load, it reduces the chance of the HIV mutating, changing or evolving. This means there is less chance of your HIV becoming drug resistant. Bottom line: Biktarvy is a treatment for HIV infection, that contains 3 antiviral medicines: emtricitabine, tenofovir, alafenamide and bictegravir. Biktarvy starts reducing the HIV viral load in as little as 4 weeks and continues to decrease the levels over the first 3 to 6 months to usually become undetectable. Biktarvy reduces the HIV viral load and increases the CD4 plus T cells, which means you will stay healthier for longer, have less risk of passing on HIV and less chance of the HIV mutating and becoming resistant to drug treatment. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.